I'd like to welcome you all to our Thursday 1:30 p.m. session, where today we will have Tori once again talk about brain and cardiovascular health with us today. So learning about our bodies is always so fun and interesting and exciting, and you may learn a new tip that will deeply, positively affect your life. So thank you all so much for coming on. I'm going to read our disclaimer before we get started. The WildTech DC Senior Digital Equity Program, its owners and presenters offer technical assistance, virtual health, well-being, information designed for educational purposes only. You should not rely on the info and any apps or topics made by WildTech, including but not limited to mobile device applications and any social media pages maintained by WildTech, its owners or presenters as a substitute for professional medical advice, diagnosis, treatment, or legal advice. Thank you so much for letting me read the disclaimer. If you cannot see us here or see the screen, please let us know in the chat. As always, let's make sure to keep our TVs and cell phones in mind so we're all able to hear and understand each other. And as always, make sure you take notes and or screenshots. You can take a screenshot by hitting the home button and power button on your iPad. And you can also review the YouTube video that will be on our channel soon enough so you can review and rewind as much as you'd like. Thank you so much, Tori, for coming on and presenting. I know we're going to learn a lot. I look forward to being your tech support today. Let's all make sure to stay on for our poll to let us know how you felt about the session today. And Tori, if you could introduce yourself and your topic, I'd really appreciate that. And we're going to have a great session. So thank you so much.
Sure. Thank you, Alex. Hi, everybody. I'm Tori. I think I've met quite a lot of you before, but I'm an occupational therapist and I work with people in their homes. And one of the things that I love to do the most is learn about our bodies and then share that information. So today's topic, it's actually less than the brain. It's actually bigger. It's going to be the nervous system and the cardiovascular system. And it's a pretty in-depth presentation in the sense that hopefully you're going to learn a few good things about those two systems in your body. But I tried to keep it like so it's not too complicated. But please, hopefully I've saved enough time at the end for questions. And as usual, as Alex said, the reason I like doing these presentations and talking about these things is because I hope that with extra knowledge about your body, you'll be able to take it will empower you to maybe take better care of something in particular, or to have information to talk to your provider about any concerns you have. And I'd like to emphasize again what Alex said, that I am not a physician. I'm not a healthcare provider in that sense. So I can't give you any advice about your particular condition, but certainly we can try to like chat about things, and I can give you, excuse me, my perspective from working with people in hospitals and other facilities that maybe have gone through some of the same things. Okay, so I'm ready to share my screen. All right. Oops, hit the wrong thing. Okay. Okay, can everybody see that?
Yep, you are good to go.
Okay. So I kept the title Brain and Cardiovascular Health just because I thought it would be consistent. But again, we're going to talk about the whole nervous system, actually, is the first thing we're going to start about. And I apologize if some of this is a repeat from things you've learned from other people, but hopefully it'll just emphasize things you already know. And I will also make a PDF of this to share, which I didn't do yet, but I'll make sure I do it and send to Alex, because I'm not going to read all these slides. There's a lot of information, so you can refer back to it later. But we're going to start with the nervous system. So the nervous system, as that paragraph says there, it's really, as you know, it's the communication pathway in your body. So it's where it transmits messages along this complex system of nerves to help you do things. So those are things that you might voluntarily want to do, like move your arm or move your leg. And it's also things that you don't, fortunately, have to think about, like your heart beating and your lungs breathing. So it's a hugely important, hugely complex system that we're going to try to break down a little bit here. And your nervous system has two major components: the central nervous system and the peripheral nervous system. So I'm going to talk about these so you don't have to remember that. but we're going to start with the central nervous system. So one of the components is your brain. And this, I'm sure you all know, this is like well, it used to be called the central processing unit, which I think is still a term in computers, but this is the CPU of your body. So this is where everything sort of takes place, right? Like all the messages are created, all the information is received and analyzed, and then decisions are made. So I think that science doesn't understand nearly enough about the brain, or maybe as much as they think they do, or as much as there is to know about it. Maybe that's a better way to say it. It's such a complex organ. But what you can see there is that your brain is divided into lobes. And what's interesting is if you start at the very bottom, the yellow sort of rectangular looking thing, that's your brainstem. That is by far the most important one. That's the one that you don't have to think about anything. That is the place where breathing and your heart rate and all those things are taken care of. So that is where everything starts. And then it kind of moves from there. So the sort of beigey squiggly line one called the cerebellum, that one's important for balance. So you might know that somebody that had a stroke in their cerebellum, they tend to be very off balance when they walk. A lot of issues there. The purple this is at the back of your head. So the purple is the very back of your head, kind of like where the occipital lobe, that ridge in your skull is. That's where a lot of vision is processed. So if there's any damage there, you might have some problems with your eyes. This would be separate than damage to your eyeballs. This would be like the processing part of your vision in your brain. And then you move up to the pink and you're at the parietal lobe. So this is a lot of movement. The green is temporal, where you got speech and memory. And then finally we get to the blue, which is the frontal lobe. And this is like where the most complex things that you are kind of in control of happen. So things like making decisions, planning a vacation, making sure you're socially appropriate in situations. So you might meet people that have had some damage to their frontal lobe in the part of their brain, either through a stroke. There is something called frontal lobe dementia. There could be any number of reasons. And all of a sudden, like they're just saying stuff that you can't believe they're saying. Their personality is totally changed. So probably there's some component of the frontal lobe there. So anyway, these are all the parts of your brain. So if there's any damage to any one of them, you'll likely see some of these things affected based on where it has been where it's been damaged. So you've probably heard there's this conversation about the right side brain, the left side brain, and how the left side is the more analytical side and the right side is the more creative side. I'm actually going to show you a video that debunks that. So fortunately for us, that's not the case. Even though you have two halves of your brain, there's a lot of cross communication. So if there is damage on one side, it doesn't mean that you completely can't do that thing anymore. There might be an opportunity that the other side of your brain can pick it up. So that's actually a positive thing, that we don't have this like very distinct right brain, left brain sort of functional component of it. What is interesting about right and left, though, is that your left hemisphere of your brain, the left side of your brain, controls the right side of your body, and the right hemisphere controls your left side of your body. So that's super interesting. And I think that if you know anybody that's maybe had a stroke and the doctor says, they've had a left-sided stroke, but their right side is the side that's been affected, it might be confusing, but that's why there's this crossover in motor. So I'm going to show you this video about the right and the left brain because I thought it was kind of interesting.
Behold the human brain, its lumpy landscape visibly split into a left and right side. This structure has inspired one of the most pervasive ideas about the brain, that the left side controls logic and the right creativity. And yet, this is a myth, unsupported by scientific evidence. So how did this misleading idea come about, and what does it get wrong? It's true that the brain has a right and a left side. This is most apparent with the outer layer, or the cortex. Internal regions, like the striatum, hypothalamus, thalamus, and brainstem, appear to be made from continuous tissue, but in fact, they're also organized with left and right sides. The left and the right sides of the brain do control different body functions, such as movement and sight. The brain's right side controls the motion of the left arm and leg, and vice versa. The visual system is even more complex. Each eye has a left and right visual field. Both left visual fields are sent to the right side of the brain, and both right fields are sent to the left side. So the brain uses both sides to make a complete image of the world. Scientists don't know for sure why we have that crossing over. One theory is it began soon after animals developed more complex nervous systems, because it gave the survival advantage of quicker reflexes. If an animal sees a predator coming from its left side, it's best off escaping to the right. So we can say that vision and movement control are two systems that rely on this left-right structure. But problems arise when we overextend that idea to logic and creativity. This misconception began in the mid-1800s when two neurologists, Broca and Wernicke, examined patients who had problems communicating due to injuries. The researchers found damage to the patient's left temporal lobes, so they suggested that language is controlled by the left side of the brain. That captured the popular imagination. Author Robert Louis Stevenson then introduced the idea of a logical left hemisphere competing with an emotional right hemisphere, represented by his characters Dr. Jekyll and Mr. Hyde. But this idea didn't hold up when doctors and scientists examined patients who were missing a hemisphere or had their two hemispheres separated. These patients showed a complete range of behaviors, both logical and creative. Later research showed that one side of the brain is more active than the other for some functions. Language is more localized to the left and attention to the right. So one side of the brain may do more work, but this varies by system rather than by person. There isn't any evidence to suggest that individuals have dominant sides of the brain, or to support the idea of a left-right split between logic and creativity. Some people may be particularly logical or creative, but that has nothing to do with the sides of their brains. And even the idea of logic and creativity being at odds with each other doesn't hold up well. Solving complex math problems requires inspired creativity, and many vibrant works of art have intricate logical frameworks. Almost every feat of creativity and logic carries the mark of the whole brain functioning as one.
So I thought that was really interesting because I do think there's a lot of urban myth about left-sided and right-sided people, and a lot of people identify themselves as that. So again, the reason I wanted to share that is because I think it's good news, because I think that if there is damage to one side of your brain, there's no fear of losing like all your creativity or all your logic. You know, there's enough cross communication that that's a good thing. What it does affect, if you, as again to emphasize, is if you injure one side of your brain, it will likely affect the movement of the other side of your body. Like that is a fact that they know. Okay, so the brain is one part of the central nervous system. The next is your spinal cord. This is a very complicated picture. Don't worry about that. But I just wanted to show you that the spinal cord goes right down the center there. So, and your spine, as you may know, is divided into 4 sections: the cervical, thoracic, lumbar, and sacral. And the reason I also like this picture is because, can you see how your spine is an S? And that is the way our spines are supposed to be. They're supposed to be this S curve to your spine. And what unfortunately happens for us, a lot of us, is that thoracic spine right in the middle, all the ones that are marked with T's. If we sit a lot and if we're sort of hunched over, looking at our phone, looking at stuff in our lap, maybe not sitting upright on the couch, whatever it might be, that thoracic spine tends to go in the other direction. And that's where you start getting like more of a hump, maybe up at the top of your shoulders. But additionally, other than just how you look, it affects the health of your spinal, your nerves and your spine, because it's supposed to be in this shape. If it's in the other shape and your whole spine is one big round C, you can see that there might be some compression of the vertebrae. So I don't know if that makes sense, and we can talk about it if you have any questions for me afterwards. But this is another reason, besides looking good and having good balance, that you should be very aware of your posture, because you want to try to maintain this S curve in your spine as much as you can for your spine health. So again, this is another picture of your spine. So you can see that there are these blue spongy things. Those are your discs that go between your vertebrae. And I have a little video about this. The nerves come from the spinal cord, comes from your brain through your spinal canal, and then these little nerves come out, and that's how it all functions. So this is why it's so important to maintain a healthy back as much as you can, because pinched nerves, all those things, as you may know, can be very uncomfortable and really affect you. So this is a cool video about the spine I thought might be interesting.
The spinal column, or backbone, is one of the most important parts of your body. It provides the main support, allowing you to stand upright, bend, and twist. 33 individual bones interlock with each other to form the spinal column. The vertebrae are numbered and divided into regions. C1 through C7 cervical vertebrae form your neck, support your head and neck, and allow you to nod and shake your head. T1 through T12 thoracic, that's the 12 vertebrae that are joined by ribs to form your rib cage. L1 through L5 lumbar, your 5 sturdy lumbar vertebrae carry most of the weight of your upper body and provide a stable center of gravity when you move. 5 vertebrae of the sacrum and 4 of the coccyx are fused. It makes up the back wall of your pelvis. Between each of the movable vertebrae is located the intervertebral disc. Intervertebral discs consist of a thick outer layer with a crisscrossing fibrous structure, annulus, that surrounds the soft, gel-like center, the nucleus. Discs function like shock-absorbing springs. The annulus pulls the vertebral bodies together against the elastic resistance of the gel-filled nucleus. When you bend, the nucleus acts like a ball bearing, allowing the vertebral bodies to roll over the incompressible gel. Each disc works in concert with 2 facet joints, forming a spinal motion segment. The biomechanical function of each pair of facet joints is to guide and limit the movement of the spinal motion segment. The surfaces of the joint are coated with cartilage that helps each joint move smoothly. Directly behind the discs, the ring-like vertebral bodies create a vertical tunnel called the spinal canal or neural canal. The spinal cord and spinal nerves pass through the spinal canal, which protects them from injury. The spinal cord is the major column of nerve tissue that is connected to the brain and serves as an information superhighway between the brain and the body. The nerves in your spinal cord branch off to form pairs of nerve roots that travel through the small openings between your vertebrae, intervertebral foramens.
So hopefully, although the spine isn't part of the nervous system per se, you can see how, well, our bodies, it's hard to separate out any system because our bodies all work in conjunction with each other, all the systems. But it's very important, as you can see, to maintain, again, like a healthy spine so that your nerves have an easy pathway to get where they need to go, which is the next part. So the peripheral nervous system. So here you can see, and you may probably already figured this out, but from your spinal cord, you have these huge branches of nerves that go to the rest of your body. So again, the central is your brain and your spinal cord, and the peripheral are all these other nerves that go out to the rest of your body. And we're going to talk about peripheral neuropathy because I know that's something that is unfortunately pretty common. So I will get to that. This is just a quick video about the difference between the central and the peripheral nervous system.
Thanks for stopping by. This is 2 Minute Classroom, and today we're talking about the central nervous system versus the peripheral nervous system. If you're new here, welcome. My goal is to save you time and reduce your stress as a student by simplifying difficult concepts in only a few minutes. So if you want to spend less time studying and stressing and improve your grades, subscribe. And now onto the nervous system. Let's start with the central nervous system, or CNS. The CNS consists of the brain and the spinal cord. The brain is made up of the cerebrum, the cerebellum, and the brainstem. The cerebrum is divided into 4 major lobes: the frontal lobe, the temporal lobe, the parietal lobe, and the occipital lobe. Overall, the cerebrum is responsible for our higher-level nervous system function, including memory, emotion, problem-solving and reasoning, movement, and much, much more. The cerebellum sits on the back of the brain and plays a major role in movement, balance, and general motor control. The brainstem sits at the base of the brain and connects the brain to the spinal cord. It is responsible for regulatory processes like breathing, blood pressure, and eating. The spinal cord is a vital part of the nervous system that runs from the base of the brain down through the back. It acts as a communication pathway between the brain and the rest of the body. The spinal cord also plays a key role in controlling movement and sensation and reflexes, including the knee-jerk reflex. Now, onto the peripheral nervous system. The peripheral nervous system is the part of the nervous system that is outside the brain and spinal cord. It includes all the nerves that reach every part of the body, such as your limbs, organs, and other structures. The PNS is divided into 2 main parts: the somatic nervous system and the autonomic nervous system. The somatic nervous system controls voluntary movement and sensation in the skin, muscles, and joints. It is responsible for relaying information from the brain to the skeletal muscles, allowing us to move our limbs and perform other voluntary actions. The autonomic nervous system, on the other hand, controls automatic functions such as breathing, heart rate, and digestion. It is responsible for relaying information from the brain to the internal organs, allowing our body to function without conscious control. The autonomic nervous system is further divided into 2 branches: the sympathetic and the parasympathetic. These 2 branches work in opposite ways. The sympathetic branch increases activity to the organs, and the parasympathetic branch decreases activity to the organs. If you have a test coming up, check out my test prep playlist, or
So that was really brief, and I promise I'm going to tie this all together for you, why it's important.
my help.
Okay, so I wanted to show this one last video, and then I'm going to talk to you a little bit about, we're going to get into, I know we talked about diseases and how that was what one of the questions was that led me to make this talk. So I promise I'm going to get to that. But I really want to talk about this neuroplasticity idea, because I want everybody always to be very optimistic about your brain and your body. So this is a good thing.
Neuroplasticity is a huge deal, in particular for human beings, because neuroplasticity is the way that we continue to shape our understanding of the outside world. Your nervous system's main job is to make predictions about what's going to happen in the outside world and to be able to respond in an adaptive way. It's really a prediction machine. So neuroplasticity, this change of the nervous system in response to experience, is the way that your nervous system updates its maps of prediction. If we were to play a sport or a game, or maybe even you would subject me to an experiment, or I would subject you to an experiment, where you would be rewarded for intentionally looking in the opposite direction of a sound, for instance, like that. If you did that enough times and with enough focus and attention, you would get so-called neuroplasticity. Those maps would shift and change such that a week later, a month later, maybe even 10 years later, if you heard a click over there, there's a higher probability that you would look in the opposite direction. We also have maps of prediction for things like emotional responses, how we think people will respond if we do A or B, how we think a person will respond or act if their face happens to be in a particular way or their skin tone. So we're constantly updating these maps. Neuroplasticity is the way we update those maps. And just to put a little bit of meat and detail on what neuroplasticity is, we have neurons, which are nerve cells. We have other cell types in our nervous system, but those nerve cells have an incredible capacity to change their patterns of connections. Their points of connection are actually little spaces called synapses. And synapses are where these different neurons transfer electrical and chemical information between each other. And basically your entire experience, what you sense, what you perceive, what you think, what you feel, and what you're able to do or not do is dictated by those patterns of electrical activity and chemicals. Neuroplasticity is literally changes in the patterns of connections between those neurons. So if you think about something like Google Maps, it's one way, but if you build a new road, there's a new road there. Neuroplasticity is essentially like building new roads. The mechanisms of neuroplasticity are quite different early in life. You can learn passively just by experience. Kids could learn several languages even without an accent up until about age 12, and then it gets much more difficult to learn languages without an accent. Then at some point, right about the age of 25, the whole process shifts. Neuroplasticity still can occur, but the whole mechanism for how it occurs changes. It takes more deliberate focus. There's one exception to that, which is the bad stuff. Typically, a traumatic or fearful event only takes once to reshape your nervous system. The good news is there are things that you can do to reshape your nervous system, additional plasticity to change those connections so that the traumatic or fearful event is no longer traumatic or fearful.
So, another way to think about this is, I like to think of it as like your brain has these pathways, right? Like very similar to vinyl albums that we used to have. And that there's these grooves and these paths, and that you're pretty much going to react the same way in a situation over and over again because you have this groove in your brain. But if you maybe want to learn some new skill, you can potentially add a new groove to your brain. Or if the way that you personally react to a situation is no longer good for you, you can learn a new way to react. Or if there's damage to one side of your brain, potentially your brain can develop a new path. So it's exciting, I think, the idea of neuroplasticity. It gives you some hope that maybe there's things that you can do. Of course, as he mentioned, and as I mentioned last time, as we get older, it takes a lot more effort, and it may not be as easy as it or as complete as when you're before the age of 25, but there's still some optimism that you can improve your brain or change things because of that. So let's talk about some of the disorders for this nervous system. These are probably the most common that we come across, and that you may know. So there's a couple of degenerative conditions of the brain, and we'll talk about those. And then, of course, peripheral neuropathy. So the first one being Parkinson's. So Parkinson's, unfortunately, is a degeneration of the brain. They don't know why it happens. There's unfortunately not a cure for it to stop it. And you may know the common symptoms is that people slow down, they might have impaired balance, there's a whole host of things that can happen. And it generally gets worse over time. But the one thing you can do for Parkinson's is to try to manage the symptoms, through exercise, through diet, through being mindful, through stress, managing your stress. Things like that can help manage the symptoms, but unfortunately, there is no cure for Parkinson's. The second sort of brain, I guess disorder we'll call it, that's common in older adults is dementia. So dementia is actually, as you can see there, it's a term for a collection of symptoms. So there are diseases that have dementia as symptoms, which is different than saying like, dementia in and of itself is a disease. And you can see the last sentence there. It is not a normal part of aging to have dementia. I have a slide about normal memory loss, which is different than dementia, okay? So these are some causes of dementia. The most common is Alzheimer's, which I guess you're probably familiar with. There could be other causes of dementia, such as vascular, frontotemporal, as I was saying. There might be damage to the frontal lobe of your brain, stroke, head injury, infections, metabolic, all those things can cause dementia. And I think that's important to know too, because I have seen quite often, and I think we've talked about this, people with urinary tract infections will all of a sudden have like this crazy confusion and like not be themselves, which might be a form of dementia from a urinary tract infection. So again, dementia is just a symptom of a disease versus normal age-related memory loss, which is this very common thing that happens as we get older. The difference is that if you have normal age-related memory loss, it doesn't affect your ability to sort of live safely and independently. Eventually you remember the word, eventually you remember where you put your keys, eventually you remembered why you walked into the bedroom. Like all those things are totally normal, and it doesn't affect you being safe. Where it becomes a concern for dementia is if you have left the house to go do something and you have absolutely no idea where you are, or you've forgotten the name of your children or your spouse and you absolutely can't recall it. That's when it starts becoming kind of a concern, right? So again, we all have memory loss. When it becomes a concern for dementia is when you really feel like you can't function independently, you're not safe, your friends or relatives, whatever, are not safe. And so that's when you want to consult with a physician for sure. Now let's just talk a few minutes about Alzheimer's. So unfortunately, Alzheimer's is similar to Parkinson's in that they understand it to be a neurodegenerative or disorder, so that there's degeneration of your brain. Unfortunately, they don't know what causes it, so they cannot stop it. And sorry, this is blurry, but these are some symptoms of Alzheimer's. So of course, the memory loss, as you know, but there might be withdrawal from social activities. You may forget where you are. You can't do things that you used to do. Poor judgment, unfounded emotions, like very sad, very angry, very whatever it might be. So these are some common symptoms. And I'm sure you could do a whole talk just about Alzheimer's, honestly. But so although there's not a cure for Alzheimer's, again, you can manage symptoms. You can try to make the safe space for somebody. There are things that you can do to try to make their life and the caregiver's life a little bit easier. Again, that's a whole nother conversation. But as usual, exercise is one of the things that we can do to try to mitigate the risk of or delay the onset of these dementias, particularly Alzheimer's. Healthy diet, just general, like staying engaged, like continuing to do these wild tech things are great. Making sure you're sleeping well and you're taking care of your mental health. So they really do think that, although they don't know exactly what causes Alzheimer's, they do think that taking care of your health in general will hopefully reduce your risk or at least delay onset if it's something that's maybe going to happen to you. Okay, and this is about peripheral neuropathy. And then I actually think I might take a break and see if there's any questions before we go on to cardiovascular. But I know this might be important.
The nervous system is made up of the brain and spinal cord and the muscles and nerves in the face, trunk, arms and legs. The brain and spinal cord are our higher control centres. The peripheral nerves carry information to the farthest parts of our bodies. There are two main types of peripheral nerves. The motor nerves bring information down from the brain and spinal cord to the muscles and tell them to move. The sensory nerves bring information back upwards to the brain and tell us what things feel like, whether things are hot or cold, and where our hands and feet are in space. A neuropathy is one of many medical conditions which can damage the peripheral nerves. When the sensory nerves are irritated or damaged, you might experience abnormal feelings such as numbness, pins and needles, and sometimes pain of various sorts. Weakness and sometimes muscle wasting can occur when the motor nerves are attacked. There are many causes of a neuropathy. Neuropathy can be due to a problem in the spelling of your DNA code. This is something you're born with, but which may develop later in life and is called a hereditary neuropathy. Or neuropathy can be acquired and caused, for instance, by imbalances in vitamins, exposure to toxins such as alcohol or too much sugar, chemotherapy, drugs, or infections during life. A common cause of neuropathy that I deal with is inflammation. Inflammation in nerves is usually caused by an overactive immune system. These are often called autoimmune diseases. Your immune system is your body's natural defense system. Normally, it's activated when your body is exposed to a bug or a virus. The cells and chemicals required to kill off the infection are switched on for a short period of time. The bug or virus is removed, and then the immune attack settles down. In autoimmune inflammatory neuropathies, the immune system is overexcited. Instead of switching on attacking foreign things like bugs and viruses, it mistakenly affects the body's own tissues, such as the nerves in the arms and the legs. The resulting damage can occur quickly or slowly, affect all the nerves or just some of them, and may be a single monophasic condition or a long-lasting, recurrent, progressive problem. Inflammatory neuropathies can be treated with drugs and therapies that dampen down the overexcited immune system, sometimes given as a short course and sometimes given over a longer period of time. All these conditions require close clinical follow-up by a specialist doctor.
Okay. You know what? I'm going to change my mind. I'm going to keep going just because I want to talk about blood pressure and strokes because they're all sort of related, and then we'll stop. So I might go a little bit quickly over the next two slides so we can get to that. But the cardiovascular system and the nervous system are so interrelated, it's kind of hard to separate them. So let me move through this and then we'll get to the questions. But so the cardiovascular system is basically your heart and your blood vessels. And so its role obviously is to bring blood to your organs and tissues throughout your body. So again, the nervous system is to bring the signals and the information back and forth, and the cardiovascular system is to bring the blood and back and forth, and other fluids. But so essentially you have the heart, right? Of course, you all know this. It pumps the blood. It goes through the arteries, it goes through the lungs, and then the veins carry the deoxygenated blood back up to get some more oxygen. So basically what you're concerned about here is your heart, your lungs, and your arteries and veins. That's your cardiovascular system. So let's talk about blood pressure. I thought this was a really good video about blood pressure. So you can get an idea of like what's happening in your cardiovascular system related to blood pressure.
If you lined up all the blood vessels in your body, they'd be 95,000 kilometers long. And every day, they carry the equivalent of over 7,500 liters of blood, though that's actually the same 4 or 5 liters recycled over and over, delivering oxygen and precious nutrients like glucose and amino acids to the body's tissues. All that blood exerts a force on the muscular walls of the blood vessels. That force is called blood pressure, and it rises and falls with the phases of the heartbeat. It's highest during systole, when the heart contracts to force blood through the arteries. This is your systolic blood pressure. When the heart is at rest between beats, blood pressure falls to its lowest value, the diastolic pressure. A typical healthy individual produces a systolic pressure between 90 and 120 millimeters of mercury, and diastolic pressure between 60 and 80. Taken together, a normal reading is a bit less than 120/80. The blood traverses the landscape of the body through the pipes of the circulatory system. In any plumbing system, several things can increase the force on the walls of the pipes: the properties of the fluid, extra fluid, or narrower pipes. So if the blood thickens, a higher pressure is needed to push it, so the heart will pump harder. A high salt diet will lead to a similar result. The salt promotes water retention, and the extra fluid increases the blood volume and blood pressure. And stress, like the fight or flight response, releases hormones like epinephrine and norepinephrine that constrict key vessels, increasing the resistance to flow and raising the pressure upstream. Blood vessels can usually handle these fluctuations easily. Elastic fibers embedded in their walls make them resilient. But if your blood pressure regularly rises above about 140/90, what we call hypertension, and stays there, it can cause serious problems. That's because the extra strain on the arterial wall can produce small tears. When the injured tissue swells up, substances that respond to the inflammation, like white blood cells, collect around the tears. Fat and cholesterol floating in the blood latch on too, eventually building up to form a plaque that stiffens and thickens the inner arterial wall. This condition is called atherosclerosis, and it can have dangerous consequences. If the plaque ruptures, a blood clot forms on top of the tear, clogging the already narrowed pipe. If the clot is big enough, it can completely block the flow of oxygen and nutrients to cells downstream. In vessels that feed the heart, that will cause a heart attack when oxygen-deprived cardiac muscle cells start to die. If the clot cuts off blood flow to the brain, it causes a stroke. Dangerously clogged blood vessels can be widened by a procedure called an angioplasty. There, doctors thread a wire through the vessel to the obstructed site, and then pass a deflated balloon catheter over the wire. When the balloon is inflated, it forces the passageway open again. Sometimes a rigid tube called a stent is placed in the vessel to help hold it open, letting the blood flow freely to replenish the oxygen-starved cells downstream. Staying flexible under pressure is a tough job for arteries. The fluid they pump is composed of substances that can get sticky and clog them. And your typical healthy heart beats about 70 times a minute. and at least 2.5 billion times during an average lifetime. That may sound like an insurmountable amount of pressure, but don't worry. Your arteries are well suited for the challenge.
So that's blood pressure. And I'm going to skip ahead to the stroke video and then we'll move on from there. I'm going to skip the heart video. I don't think that's as important. But I do want to go over the stroke one.
A stroke is a disease affecting the brain's arteries and occurs when blood flow to the brain is interrupted, either due to a blockage or a ruptured blood vessel. A stroke caused by a blood clot is called an ischemic stroke. In everyday life, blood clotting is beneficial. When there's bleeding, platelets immediately rush to the damaged blood vessel, ready to take action. Once they reach the site of injury, the platelets undergo a transformation. Activated platelets sprout tiny tentacles, much like an octopus's, and latch onto the damaged area. These tentacles then start to weave together, forming a mesh-like structure that traps blood cells and eventually forms a clot that stops the bleeding. In the case of a stroke, however, blood clots are dangerous as they can obstruct arteries. There are two ways an ischemic stroke can occur. Embolic strokes occur when a blood clot forms somewhere in the body and travels through the bloodstream, eventually becoming lodged in one of the smaller blood vessels of your brain. The name embolic stroke comes from the word embolus, which refers to a blood clot that travels through the bloodstream. The second kind of ischemic stroke is a thrombotic stroke. As the blood flows through the arteries, it may leave behind cholesterol plaques that stick to the inner wall of the artery. Over time, these plaques can narrow the artery and prevent blood from passing through. The name thrombotic stroke comes from the word thrombus, which refers to a blood clot that forms within a blood vessel. Strokes can not only be caused by blockages, but also by a ruptured blood vessel in the brain. This is called a hemorrhagic stroke. Their number one risk factor is high blood pressure. Hemorrhagic strokes are generally considered to be the deadliest type of stroke. The mortality rate a year from the stroke is about 50%, with half of these deaths occurring within the first 2 days. Thank you for watching this video. If you'd like to know what to do,
So let's so we're going to talk about what I like to talk about now is just, how do you decrease your risk? So obviously, if you have any of these conditions, Parkinson's, any of the dementias, Alzheimer's, peripheral neuropathy, hypertension, diabetes, all those things, of course, you need to be managed by your physician or your primary care provider. And I'm sure you all are for whatever conditions you may have. But in addition to that, you can certainly, do things like stay active, like we've talked about, exercise your brain and your body. It's very important to keep your brain as healthy as the rest of your body. Again, your healthy diet, healthy weight, good sleep, having regular medical appointments, and maintaining your social connections. I know that's so important for our general overall health and wellness. So I'm so glad that WildTech is going to continue because I know you guys have a great social connection here. So I'm going to open this up for questions. I do want to correct myself. The cardiovascular system is just blood. The other fluids have different systems to move them through your body. So it is just blood. But let me stop sharing and we will open it up because I'm sure you have questions and that was a lot of information.
Oh, thank you again, Tori, for your wonderful session. It's just amazing to see those 33 discs in your spine and just how it came to be or how humans came to be. It's amazing on, the whole process and even just the naming of the strokes, that was very interesting and really goes to show how one thing in your body can affect everything. So it's good to do some wellness checks for yourself for everything.
Yeah.
So thank you so much. Any questions or comments or reactions, please raise your hand in Zoom, or you can put it in the chat as well. I see we have 3 hands already. Wonderful. Ms. Doris, thank you so much. You have a question or a comment for Tori today?
Hey, Tori,
Hey.
I want to ask you a question now. You were saying something that you feel certain things in your feet or whatever that's uh, dealing with the stroke things or something. So if you going through that, do you need to specify that to your physician to check it out before you have a stroke?
I'm not sure I understood exactly what you were saying, Miss
Uh,
Doris.
I
Can you say
I
it
have
again?
pains in my feet sometimes.
Uh,
In my feet. One of the slides that you showed that. So if you experiencing that lightly, do you need to bring that to your physician?
okay. So you have a new pain in your feet?
Yeah.
Yes, I think you should definitely mention that to your provider for sure. Yeah, I think that would probably be a good idea. I don't know if it's indicative. I think you said something about a stroke. I don't know if necessarily it's means that you're at risk for a stroke from that per se, but certainly if you have a new symptom like that, it's worth checking it out. Yeah.
Yeah, and I had brain surgery a couple of years ago too. And I never experienced it until this happened.
How long have you had the
The
feet?
brain surgery 3 years ago.
Okay. Yeah, definitely give them a call and let them know what you're experiencing.
Okay, thank you.
Thank you, Ms. Doris. Good luck. You got this. Asking for help or assistance is the main hurdle. So once you let them know, I hope everything goes well. We have Anne and then Geraldine. Thank you so much.
Can you hear me?
Yep.
Okay, I'm sorry. I got knocked out in the middle of some of your stuff. It took me a minute to get back in. Um, I wanted to ask you about sciatica. Is sciatica a nerve issue that is mainly in your back or connected to your back nerves or
Yes, thank you for asking that. I should have thought about that. Yes, so your sciatic nerve is one of the longest nerves in your body, and it originates, if I remember correctly, it's like down by your lumbar spine where it hits your sacrum, sort of at that very end of your spine.
mm-hmm.
And it actually goes from your spine through your buttocks, and I'll tell you why that's important in a minute, down the back of your leg, down your leg to your foot. So it's a very, very long nerve. And people can have pain and or numbness anywhere along that entire pathway. Typically, it's caused by one of two things. It's either in your spine itself. So when I showed you the pictures of the spine, if your disc is not healthy and everything is compressing, it can compress the nerve there. Sometimes it also is occurring through your buttocks. And the reason why is because your gluteal muscles, there are several muscles, you may know this, your buttocks, they're all kind of packed in there. And if you have any irritation, particularly from like sitting too much, um, anything that causes those muscles to get slightly inflamed, a lot of times that's what causes the trouble with sciatic pain, because the nerve goes between two muscles, your piriformis and your gluteal muscles, and it gets squished. So if that's where it's coming from, that's a lot easier typically to manage with like physical therapy or maybe massage or not sitting down as much, things like that. So hopefully when you're experiencing sciatica, it's in a place that can be managed by those sort of conservative measures, by standing differently, sleeping differently, sitting differently, doing some exercises. When it's coming from between your vertebrae, if that's where the compression's occurring, it's a little bit more difficult to manage without more intensive sort of medical intervention. Did that help answer it?
that helped a lot.
Okay.
That helped a lot, yes. And but I was concerned because I got this pain going up on the inside of my leg, going up in my groin area. And I didn't know that sciatica went over on the other side. So that's what I was a little concerned about. Now I want to ask you, okay,
Yeah, I'm just
now,
thinking, well, it kind of, while you're talking, I'm going to pull up a picture of the pathway of the sciatic nerve and share it with you, but go ahead and talk. Yep.
okay, now the neuropathy. Is neuropathy brought on by, because I missed part of what you were saying because that's when I got knocked out when you were talking about that. So is the neuropathy a nerve or is it a condition of the nerve, or exactly kind of what it?
So neuropathy just means that there's damage to the nerve. There's neuro is nerve, and then anything that ends in PATHY is generally damage to it. So yeah, it's damage to the nerve.
Okay.
Yeah, it's probably one of the peripheral nerves. So yeah, let me show you this picture. I'm going to share my screen for one quick second, just so you can see the pathway of the sciatic nerve. But if you're having any, again, if anybody's having any new pains, please talk to your physicians about it. But can you see this red line? That's your sciatic nerve. It goes
Okay.
from your back down, like through your buttocks,
Mm-hmm.
down your thigh, around your calf, and like down to the bottom of your foot.
Okay.
It's a very long nerve that has lots of places where it can get pinched and cause trouble. But if you're having a new pain, again, please talk to your doctor for sure.
Okay. Well, you give such good information. I'm so glad to see you.
Thank you.
Because I go there with these questions to my doctor, and he says, "What book have you been reading?" I said, "No, there's somebody that brings us great information." And I said, and I don't go home, I don't lay down and dream about it. I just wonder where it came from. And I find out, I think that you need to, to give me a look at and see what's going on. So I appreciate you, Tori, and thank you so much.
Thank you. Yeah, of course.
And thank you for that explanation.
Sure. Yeah.
Yeah, and the neuropathy too. I'm gonna look at the rest of that when it's posted. But
Okay.
thank you so much.
Sure.
Thank you, Anne. We got Geraldine next, and then Miss Celeste.
Hi,
Great.
hi, Tori.
Hi.
Thank you for
Hi.
today. Glad to see you again. But listen, this is about high blood pressure. Now, I heard on social media, some of the doctors are really good. And I heard from one of them that when it comes to high blood pressure, you don't play around with it because you could have a stroke. And he said that you should take your high blood pressure medicine as opposed to trying to use diet to get rid of it. Because if you could use diet to get rid of it, you would have already used the diet in the first place. So now you need to take your blood pressure medicine so that you won't have a stroke if you have high blood pressure. How does that sound to you?
Well, number one, I think you should talk to your doctor, not a doctor on the internet, to get your advice.
Okay.
Yeah, but certainly if you've been prescribed medicine, certainly take it as your doctor prescribes. I think probably when you talk to your doctor, what they might suggest is that it's maybe not one or the other, that your diet can certainly help manage it as well. So if you saw like in that video how it showed that the increased salt intake increases the amount of fluid going through your arteries, right? And that's what also will elevate your blood pressure. So certainly eating less salt will help with that and could potentially help with your blood pressure. But certainly if it's at a point where a diet alone isn't going to help it, taking your medication is very important. Yeah. Yeah.
Okay. Thank you, Tori.
Yeah.
Thank you so much. We got Miss Celeste next. Any others? Please raise your hand if you have a question or comment. Thank you so much.
Hi, Tori. Thank you. This information was so helpful. I came on just in the nick of time because I have spine issues, and I found out it was a nerve that was stemming from my neck to my lower back, and I was prescribed something to, ease the pain. But I thank you for this information. And you had mentioned degenerate, so I think I came in on that. Is that part of a nerve issue?
So I was talking about Parkinson's and Alzheimer's, which are both degenerative conditions of the brain. Yeah, so that's like just to try to so people can understand what causes those, and unfortunately, they haven't figured out a way to stop it. But there's just two common brain conditions that are.
Oh, okay.
That's all. Yeah.
Oh, okay. Well, this information has been very helpful. Like I said, especially with the spine, because I have spine issues. And like you said, bending over and sitting up, just good posture. And I have a tendency to bend over to look at my phone. And my doctor told me to stop doing that because that's what's causing some of the spinal issues, just constantly bending over. But thank you so
Yeah.
much, Tori. It's very helpful.
Yeah. You're welcome. You're welcome. And yeah, I think that actually the first picture I showed you was incorrect. Like it actually starts like there's an S curve anyway. Your lumbar spine is kind of the one like, you know, when people tell you like stick your chest out. So your lumbar spine kind of goes convex. That's the one that we tend to let sort of like round out when we're sitting not properly or if we're slouching over and things like that. And when you do that, when you don't maintain the natural curves of your spine, you get that compression of those spongy discs in a way that they're not meant to be compressed. And that's when, unfortunately, over time, like they might erode and then you get bone on bone. And then that's when you start having nerve compression. So it is really important to maintain that S spine as much as you can, and maintain your posture.
Thank you.
Thank you so much, Miss Celeste. And everyone for your questions. Does anyone else have a question or a comment for Tori today? You can raise your hand in Zoom. Again, you hit reactions at the bottom, raise hand. Any more
Let me see.
questions,
Yeah.
comments? Yes, check your direct messages.
Oh, me?
Yeah,
Oh, okay.
I've been tending to tell my guests that because sometimes yeah, that does happen. Um,
Okay.
I love it. We have three more hands, but you can also share it in the chat. Um, thank you so much, you all. Wow, time flies when we're having fun. All right, we got Miss Laverne and then Anne again, and then Miss Marie. Thank you so much.
Hello, Miss Tori.
Hi.
Hi, baby. I would like to thank you for all your information that you have extended to us. It was very inspirational and educational, and I really and truly thank you.
Oh, you're more than welcome. That's, you know, as I've told you guys before, is my goal is to try to empower you to ask questions and take care of yourself. So thank you. I'm glad it wasn't too confusing. There's a lot of information today.
Yes, ma'am.
Thank you so much, Miss Laverne. That was so kind. I agree with everything. Thank you so much. We got Anne and then Miss Marie next. Thank you. Question or comment?
Tori, can these nerves cause your stomach to have issues?
Well, so potentially, so because certainly nerves go to your stomach, they go to every system in your body. Yeah, but probably it's more of a digestive issue, and then there's all kinds of things that can happen in your digestive system, unfortunately, to cause imbalances and discomfort, particularly as we get older. So, is that something you've already followed up with your doctor about?
Yeah, and then I was having an issue. Um, my cardiologist said that it might be from stress. 'Cause I've been under a lot of stress, family issues and stuff going on. Um, stressful stuff. But I was just wondering if that could and could that be part of it?
So, as you saw, as we've talked about, I mean, every system in the body is related. So certainly stress, as you saw, can elevate your blood pressure, right? Which, you know, also stress also increases inflammation in the body, which can, all of those can affect your digestive system as well. So it's probably all related. Maybe we should do maybe I can do a talk about the digestive system though, because there are some really unique things that happen there. But certainly I imagine, I mean, stress unfortunately affects everything in our bodies. So maybe try to, and I know it's hard to do this when you're in the middle of it, but just try to practice some of the things you've learned here as far as like deep breaths or just some mindfulness or something just to try to calm some of the stress down and see if that helps.
Well, believe me, I've used a lot of your recommendations. Okay,
Okay, good.
because I didn't want to go to jail. Thank you again for answering my question.
Sure.
So
Okay,
much,
thank
Anne. As always, with our presenters that we have on consistently, make sure to check out our YouTube for our past videos. So everything from the mindfulness and the fall prevention, tips and tricks and health and body. Make sure you check out our YouTube and review those. They're still very, very pertinent. So thank you. Hi, Miss Marie. Thank you so much for your question or comment.
This is about neuropathy. I've been seeing uh, reports on television that they have this neuropathy center that can cure neuropathy. Is there any cure for neuropathy?
I think they need to know what causes the neuropathy. So neuropathy can be caused, like I think that doctor was saying, by a whole bunch of things. And one way, so imagine if you have like the sciatic nerve, let's say, coming out of your spine and it gets pinched, you might have numbness in your foot. That technically is neuropathy. That's caused by the pinching of the nerve and you lose the feeling anywhere along that pathway. If it's caused by something like that you can fix, like you can fix, maybe they can do some spinal surgery, or if it's, getting squished between the muscles in your buttocks, you might be able to cure the neuropathy. But if it's by other things, like they have idiopathic neuropathy, which they have no idea what causes it, if it's by diabetes, that becomes way more complicated to potentially cure. So I would be wary of anybody on TV telling you they can fix something easily. I think if you went to a good your providers and they referred you to an orthopedic or a spine doctor themselves and they found that there was compression of your vertebrae that is pinching a nerve, potentially, but I would be very wary of somebody telling you they can fix something like that.
Well, I have neuropathy in my hands, and my doctor has given me gabapentin for it, and gabapentin does nothing for the pain. So yes.
I'm sorry. One of the things that sometimes can cause neuropathy in the hands is what they call carpal tunnel syndrome, and that's because if you can see my wrist here,
yes,
we have a band that goes across your wrist here, and underneath that band is what's called the tunnel, the carpal tunnel, and there are nerves that go through that tunnel. Well, if you get inflammation and irritation, everything gets smushed and pinched together, and that's where you can get numbness in your hand. So has anybody ever told you you have carpal tunnel syndrome?
Yes, I have carpal tunnel.
Yeah, that's probably where it's coming from.
Arthritis. Plus I have diabetes, type 2.
Yeah. Okay. So it sounds like you have a lot of irritation and inflammation there. Have you ever seen a therapist to try to do some exercises for the carpal tunnel?
No.
You might want to ask your doctor about that. There are potentially, depending on how much damage there is, potentially there's some things you can do with therapy for your hands that might help a little bit. There's bracing. Have you ever worn the braces for your hand?
Yes.
Did that help?
Years ago. I think it helped initially, but after a while I stopped wearing them and I haven't worn them since.
I would ask your doctor if you can for a therapy evaluation to reevaluate that, because the advantage of wearing those wrist braces, if you can see, it's hard to do this backwards. But so the carpal tunnel I can't do this. The carpal tunnel is here. A lot of times at night when we're sleeping, our hand tends to get relaxed, and you can see if my hand is bent, it's smushing that even further. Like all the things coming through here are getting even more smushed. So that's why they have you wear those braces at night to try to keep this as straight as possible and minimize that compression that's happening. So that's why you wear the braces at night and sometimes all the time. But I would see if you can get out and get to a therapist for a couple of sessions and have them take a look at that again and see if that helps.
No, I can't get out. I'm bedridden.
Can't get out. Okay. Maybe when do you go out to see your doctor?
No, my doctor comes in to see me.
Okay. Ask him.
I've been in the bed for about 6 years now.
Okay. Ask him about the braces and see if you can't restart those and see if that helps a little bit.
Okay, and I'll be 90 years old on the 24th of July.
Excellent. Well, happy birthday a week early.
Okay. Thanks for giving me the information.
Thank you, Miss Marie, for asking. I hope it helps out.
Yeah, it does. Thank
Mm-hmm.
you.
Mm-hmm. Oh, I love our questions today, Tori. They're so insightful.
The hard ones, yeah, they're hard ones.
Yeah, yeah, you did such an amazing job. And I learned so much. But I think maybe thank you all so much for asking those and for participating and listening. Yes, I think we'll take these two hands and then any final thoughts. So I love all the questions. You guys are amazing. We got Miss Brenda and then Miss Yvonne. Thank you so much.
Thank you. Hi, Miss Tori.
Hi, Miss
Miss
Brenda.
Tori, my youngest son will be 35 this year. When I had him, they gave me an epidural, and it felt like they took the medicine right out the freezer and put it in my back. And I've been having problems with my back ever since. My doctor did prescribe to me some years ago, like 800. I forgot the name of it, but he stopped. He wouldn't give them to me anymore, and my back is still bothering me. So my question is, I mean, I've been doing movement and exercise, but it doesn't help. Any suggestions that you can think of that will might help alleviate this pain? I take pain medicine every now and then, but it still doesn't help.
I'm sorry. Not really off the top of my head. I mean, if that was the cause of it, I really don't know what I could suggest that would help you with that. That
Yeah.
sounds like an unfortunate outcome of an epidural for sure. Yeah. I'm assuming you've done physical therapy over the years as well.
Yeah, I have. And I didn't have any problems with my back before then. And when as soon as they injected me, it just and I get tired easily, and I find myself kind of slumping over a little, so because of the pain. So
sorry.
I don't know what I could do.
Yeah, I'm afraid I don't know. That's a cause that I'm definitely not familiar with. So I'm so sorry.
Okay. All right. Well, thank you for listening.
Yeah.
Thank you, Brenda. I will say, just talk to another person, another specialist, and another opinion. You never know what may occur or happen. So that's what I'll say. I'll just keep trying. We got Yvonne next. Thank you.
Yes. Okay. Thank you, Alex. Tori, could you speak in layman's terms just about a healthy sleeping posture that maybe promotes healthy spine and maybe the stem of the brain in terms of your pillow, your mattress, and your sleeping posture? I tend to sleep on my right side all the time, and just in generalities in terms of a layman's term and for healthy sleeping posture, I'd appreciate just the suggestions.
That's a really good question that I will tell you I'm guilty of not doing a good job either. I sleep on my sides too. So ideally I do, I think I don't have a good answer for you. I'm not an expert in this at all. But I know you're not supposed to sleep on your stomach because that definitely messes with the curves in your spine and compresses too much. Ideally, I think you're supposed to sleep on your back with some pillows under your knees to help maintain that spinal curve. But I don't really have a good enough answer for you for that. I think if you're waking, do you wake up in the morning uncomfortable? Like, are there any particular problems you're having? If you're having a good sleep and you're not uncomfortable and you don't have back pain, I think to some extent it's what makes you comfortable. I think you're supposed to sleep with a pillow between your knees at night to help with any lower back pain. But
How about protecting the stem? You said everything starts with the stem of the brain.
Oh, your brainstem. So you don't need to worry about that. I mean, the reason I mentioned that is because if if anybody, if you've ever heard of anybody having like a spinal cord injury or something that severs their brainstem, like that's fatal. That's like, you know, when you hear about people like break their neck and they die right away, that's because the brainstem has been severed. Typically that doesn't happen. I mean, it's very well protected in there. So typically your brainstem is totally fine. It's just if you get into like some sort of like motor vehicle accident or some sort of accident where you've, you know, have a severing of that, that's when it becomes fatal.
How about the elevation of your head on the pillow? Any suggestions with respect to the pillow?
Yeah.
Mhm.
So again, I'm definitely not an expert on this. Yeah, I can do a little research for you, or I can maybe look into do a spinal talk for you guys. But in general, you know, you want to do what's comfortable for you. And if you wake up and find that you're having aches and pains in a particular place, and you know you need to adjust it. Some people, I think, from my experience, that it's a very personal. Some people prefer hard pillows and soft pillows. I think a lot of physical therapists recommend no pillows. So I don't know that there's a definitive way to protect it. I think the most important thing is you take the feedback from your own body. So if you're having lower back pain, if you're having neck pain, if you're having arm pain, that's when you have to shift and find the right setup for you.
Sure.
So
Okay. That's
I'm sorry.
That's enough. I didn't expect you to be ever so specific because I know it's a very personal, concern, and depends on what you wake up, how you wake up feeling, and how your joints feel. I can tell when I've not slept properly, and I maybe slept on my arm, or for some reason I have an ache or pain. I can usually figure out what might have been the cause with due to my posture, or even with the mattress. You don't want it to be too hard or too soft, and that's very personalized condition.
It is. I think it is very personal, but thank you for asking. It's an interesting question. I think, yeah, just my opinion would be just respond to your body and what it's telling you. Yeah.
Thank you so much, Tori. Good videos today, good information.
Oh.
I ran out of note paper and screenshots.
Thank you, Yvonne, for asking and for following along. I appreciate that so much.
Thank you, Alex.
Okay, Tor, I know it's almost top of the hour. It's up to you. Are you willing to answer these two hands that we have up?
Yeah, we can do that.
Okay, thank you so much, Tori. We appreciate it so much and your time. Okay, so just keeping the time in mind, we got Denise and Miss Dolores. So just keeping the time in mind, but thank you all so much for your wonderful questions today. Okay, we got Denise and then Miss Dolores.
Hi, Tori.
Hi.
I wanted to ask you a quick question. It's about my legs. It's at night, when I'm going to bed, or how you stretch your legs and your head crack like cracks. And you be like, oh, that feels so good. Okay. Now the right side doing it, but the left side had got, I guess, I don't know, in the cramp. It haven't been in the cramp Charlie horse, but it won't crack around the knee. And I'm like, now when I'm walking, I'll be walking good. I'll be okay. Then all of a sudden, someone's like, I'm like, oh shoot, I'm about to fall. Make me fall. And I could feel it around the knee. It feel a little sore, like it need to crack, like it's in a strain, and I need to crack it so it can, come back to normal. So what do you think I can do? Like massage it, exercise it, or keep moving it and let the bone crack, or what it sound like to you?
So this is something new that you feel like your knee
It
is going
did
to
it
get
one
better?
time, long time ago, and it just, went away. But now, just when I got off the couch last week and I went to go get up and stand up, and it said, "Whoop," like, it was going to get ready to make me fall. I'm like, oh, shucks. And now I've been easy walking on it because I ain't wanted, and sometimes I make a certain turn, it might do it. So, but it's around knee part, around, calf part a little bit, around it, down more by the knee, around it, in the middle part of your leg. But it seems like it need to crack, because when it cracks, it feels good.
Yeah. So, so the cracking, as I understand it, is actually just like, it's just a pop of like air being released.
Yeah.
Yeah, that's, which is not
That,
neither bad nor good. It's just, that's what it is.
yeah, that's
But
what it
I think
need to
if you,
do.
yeah, I know it probably feels like that, but I think if you have a new onset of something happening to your knee, unfortunately, I'm going to tell you again, you probably need to talk to your doctor about it, because it could be that you're having some soft, like some of the muscles around your knees or the ligaments. Knees are so complicated. There are so many ligaments and tendons that surround your knee, as well as
Mm-hmm.
the anatomy of the knee joint itself, having the discs behind it.
Yeah.
Be
Uh-huh.
any number of those things that all of a sudden now, like, you may have injured it when you were in your 20s, and now it's like coming back to haunt you. So I would actually, especially if you feel like it's going to give on you and it's going to cause you to fall, I would definitely follow up with your provider and see if he wants to take an x-ray or MRI or something and see if there's something going on.
Okay.
Yeah, I'm
Yeah.
sorry. I know you
Okay.
want to be
Well,
able to just fix it, but
yeah. Well, thank you for answering it for me. I just said, let me ask you real quick while you was on. But I'm
yeah.
continuing to keep on twisting it, moving it. Because when I be twisting and moving it, it'll crack. So it's
Okay.
more
But
like
if
a
it keeps
strain.
I hear what you're saying, but if you really feel like it's gonna give on you and you're gonna fall, like I would definitely let call your doctor and see what they recommend.
Okay. All right. Thank you. You have a blessed, safe rest of the week.
You too.
All right.
Thank you, Denise.
Mm-hmm.
Mm-hmm. All right. Well, I hope maybe that the other individual with their hand raised got that question answered. But thank you so much, Tori, for your sessions today. It was so informative, and thank you for asking and answering those questions for us today. Okay, real quick, Miss Dolores, 2 minutes. You got you so much.
Thank you, Tori, for showing that video pertaining to the brain. And it must was a blessing for me to see. And the reason I start not to say anything, but you all are family to me. So by that, I'm saying like this Monday, I go to the doctor pertaining to my brain. They had found a tumor, a cyst on the left side of my brain. So I'm going this Monday for radiation treatment. And thank God they say we're only going to be one treatment. And the reason for that is because they want to shrink that cyst. So I'm asking my family for prayers that it will only be one. And I'm asking for you all to to pray for the doctors and the nurses who'll be overseeing this radiation treatment. So by seeing this video today pertaining to the left side and the right side of the brain, what the good thing about it, when they mentioned to me is that it's not where the cyst is, it's not near my eye where it will affect my vision. It's not near my ear where it will affect my hearing. But it has grown for the last year, not a whole lot, but they want to do the radiation treatment for to prevent it from getting any larger. So by you showing that video today, it really helped ease my mind as far as what the brain looked like on the inside and what they will be doing. So I just wanted to share that and also to ask my family to keep me up in prayer as far as that everything would go okay. So that's what I just want to share today. And thank you for that video. Very very informative for me.
Okay. Thank you for sharing, Miss Dolores, and certainly will keep you in my prayers and wish you the best. Yeah.
Yeah, thank you.
You got this, Dolores. You did that initial step, and you got got the help, and they figured it out, and you're going through with everything and getting it done and worked on now, so it doesn't get worse later. So, that I'm so happy that you're doing that.
Yes. So
Good.
if you all don't see me for a few days, you know why.
You got this, Miss Dolores.
You got it. Yep.
Got this. Thank you so much for sharing.
Thank you.
Mm, thank you. All right. Thank you all so much. Tori, any last thoughts or your overall impressions for today? And Any final words for us?
It's always so hard coming up with these last thoughts because it's such a complicated topic, isn't it? So I apologize that I keep referring you back to your providers, but these particularly, obviously the brain, your nerves, and your cardiovascular system are so vitally important that if you have any concerns, definitely ask your physicians. But just in general, I think you can see that healthy diet, exercise, mindfulness, managing your stress, managing your sleep really can just be so beneficial for, as we've talked about, for everything else, but certainly for these systems as well. So please try to think about that and enjoy the rest of your summer. I guess I'll see you guys in September, right? Yeah.
Yes. So thank you, Tori. Will be fall around fall time. So we wish you luck and thank you so much again for your session and inspirational information today. So let's all say thank you to Tori and make sure you all stand for our poll. But again, let's thank you so much for the wonderful information today. Thank you so much, Tori. Have a
Thank you.
wonderful
Thank you,
Thank
Tori.
you.
And
Thank you,
don't
Thank
forget to
you.
Tori.
put
much,
you on a prayer list
Tori.
for the
Yes,
next
I
Tori.
see you.
at church.
Great session.
Thank
Thank you
you.
so
Thank
much,
you.
Thank you.
Tori.
Bye,
Thank
buddy.
you.
Bye-bye.
Bye,
Great
Tori.
session.
Happy blessed, Tori. Thank you.
Thank you.
Thank
You
you so
guys too.
much.
Bye.
Thank you.